welcome everyone to the Health Through Awareness and Thermographic Diagnostic Imaging webinar. We're experiencing some technical difficulties, so if anybody's on live, if you could let me know if you can hear me. And Dr. Leo, can you just say hello, and we'll see if we have a sound for you.
All right. Hi, everybody. I hope you can hear us.
No response yet. So.
Test. 1, 2.
It's on a delay. Yeah, it's on a little bit of a delay, so we'll give it another minute and another 30 seconds and see if we can hear somebody. But you, like I wasn't even getting the reverberation in my headset. You know how you can tell when it's kind of humming? Yeah. Yeah. Is yours doing that?
No, but I hear you just fine.
Yeah, I'm talking directly into the phone. So.
Okay.
Yeah. Well, here's what I would suggest, Dr. Leo. Let's go through it, and if for some reason it doesn't take, I know, it's a lot of your time and all of that. If it doesn't work,
we'll just do it again. We'll reschedule again.
Yeah, we could reschedule and do it again. But so.
Sounds great.
All right, let's just go through it. Let me do my introduction. So. If you all can hear me out there, I would like to introduce our speaker tonight, Dr. Leo McCormick. Dr. McCormick truly believes that he can make a difference in people's lives through his practice of chiropractic. His doctorate was earned at the well-renowned Palmer College of Chiropractic in Davenport. Where was that? Davenport?
That's in Iowa.
Iowa, okay.
Yes, ma'am.
He served an internship in patient care at the Palmer College Public Clinic, where he was awarded the prestigious Gold Coat for his care and attention to patients. After graduating cum laude in 1987, he returned to open a practice in Wayne, Pennsylvania. In 2001 in Wayne, Pennsylvania, he established his current practice in Pottstown and then opened a clinic in Elberson in 2008. So you've got a practice in Pottstown and in Elberson.
That's right.
Both going strong. And I can attest to that. My friend Lisa over there runs the Pottstown office like a well-oiled machine. Everything is always going just as it should. So as you may know or may not know, the McCormick Chiropractic is one of our off-site testing locations. And they are located at 92 Kemp Road? 90. What is the address? Yeah, 92 Kemp Road in Pottstown, PA. So,
We just lost him.
Okay. Yeah. Somebody was typing in that they could hear you. So, please bear with us, everyone. We're just experiencing a little.
There we go. There we go.
There we go. There's Dr. Leo.
There we go.
All righty.
And now I just got to get the PowerPoint back up.
Okay.
There we go.
All right, great.
Can you see the PowerPoint?
Yep, we can see the PowerPoint.
All right, terrific.
So there you are. You're at the first one. How to get yay! How to get VIP care from your oncologist. And just
it's actually how to get VIP care from your physician.
Okay.
We had originally set this up for cancer patients, but the principles are all the same. And so I have 10 steps for us to take a look at and see how can you get VIP care from your doctor. And I think the first, I want to start a little story. It's interesting. I'm going to show you a picture. My background is I've been teaching and lecturing on alternatives to health conditions from conventional medicine, especially things like cancer. And lo and behold, a couple of years back, I got cancer, and so I needed to do some treatment. So I ended up doing some chemo, and that's a picture of me getting my chemo. And so I wanted to show you this picture because, believe it or not, this is the food they were serving in the chemo suite was donuts.
Oh, that is terrible.
Yeah, and because I wanted to be a good soldier, I just took a couple pictures of some of the insanity that's happening.
Right.
But generally speaking, this is what's we know that sugar is bad for your health, and in fact we know, especially in terms of cancer treatment and cancer, they have you fast before they do PET scans, and then they give you a sugar solution which helps the dye go directly to the cancer cells and the activity, and so you pick it up. So they know that sugar feeds cancer, and so, but this is what they feed you in the IV suite. And I actually did my chemo around Halloween, and so not only did we get donuts and coffee, but we also got candy.
Oh my gosh!
But anyway, I just thought I'd show you that it's interesting what's out there, because when I say things like this, people, it's hard for them to believe, and so I actually feel somewhat blessed that I had the opportunity to go through this, so that when patients tell me what their experience is, I can say I understand, because I really do, because I was there.
Right.
So I really do know how to get VIP care, because I was able to do that, and so let's get started with that. The first step is, how do you find the right doctor for you? First off, you've got to find you've got to decide what you're looking for. Some of the things in terms of doctors is, they have personality versus their clinical abilities. Are they reassurance type of people, or are they just the facts, man? I think too often we look at reputation. I have patients that come in and I see them being either mishandled or not kindly handled by physicians, and they go, yeah, but he was written up in Philadelphia Magazine as a top doc, or it took me 2 months to get in to see him. And I always tell them, good reputation doesn't mean that person's necessarily the right doctor for you. The most important thing is having confidence and being able to communicate to your doctor, because we know that there's you can take a sugar pill and have healing abilities to it because of your belief. Your belief in that whatever you're doing is going to work. And so the same thing is, the belief and the confidence in your doctor is much, much more important than necessarily a good reputation.
That's a very important point.
Yeah. So the first step in trying to get VIP care from your physician is, what kind of patient are you? Like when I think of my wife, she needs to be reassured. She needs to have someone kind of holding her and giving her a hug on the shoulder and telling her everything's going to be all right. Whereas for me, I just want the facts. I don't care if you're nasty to me. I don't care if you kept me waiting. I just want the facts and to be moved forward. So you've got to decide, what type of patient are you? Do you need a reassurance? It
sounds like a man-woman thing.
Yeah, maybe, yeah. But it also depends upon the type of doctor, because doctors are different too.
Right.
Some doctors are warm and fuzzy and huggy-feely, and some doctors are. I took my father to a physician recently, and he never touched him, and he stood around 6 feet away from him. And he's really a good doc, and I really respect him. And he gave excellent advice, and he gave excellent care and treatment for my dad. But I can see he's not really a people person,
Right. Yeah.
So it really depends upon what you're looking for. So you got to decide, what type of person are you, and what type of doctor do you need? What resonates and connects for you? And the most important thing is, you need to be able to communicate with your doctor, so that you can get the accurate information between you and the doctor itself, because they're going to be working off of the information you give them. Now, that's very, very important. And to get VIP service, you have to have complete confidence in what you're doing and what he or she is telling you. So that's step number one. What kind of patient are you? And then deciding what type of patient you are will help you decide, what type of doctor that you need.
That makes sense.
Okay.
Yeah.
Now the next step is, if you're going for a specific condition, you need to make sure you get accurately diagnosed. And so you might say, well, how do you know that? Well, because it's always, always important to, when you're getting accurately diagnosed, you want to get 3 opinions on your condition and treatment options. So Because when I do talks for cancer, and when I'm referring people out for second and third opinions, just because you said that you have, say, cancer, well, there's differences between sarcomas and lymphomas and carcinomas, and they're all treated differently with different types of treatment. And so you need to make sure that you're fully and accurately diagnosed. And so we see that even today with things that aren't cancer related, like Lyme's. Oh my goodness, there are many different approaches to Lyme's. And so you just can't go with just the first one. You really need to take a look and say, okay, I got that. And a doctor, if you say, well, listen, I'm going for the second opinion, if a doctor is very confident in what he's doing, he'll never balk at the second opinion, ever. Because if it is what he says it is, you're going to end up going with him anyway, or going with her anyway. So you need to get differing opinions and treatment options, because although doctors do work on protocol, many times treatment options can vary widely from, I just had a patient just this week that her one doctor said, no, we're just going to monitor it. And then I told her, well, you need to get a second opinion, because I don't necessarily disagree with what the doctor said to you. And so she did. She got the second opinion, and the other doctor immediately put her in the hospital. Wow. And good thing, so if she had waited another 3 months like they were recommending, it could have been disastrous for her. So always get the other opinions, and I'll be interested to find out how the original physician, how he's going to respond to her being in the hospital. And so I think it's really important. You want to get VIP care, you make sure you get opinions so that you go in there knowledgeable. Anymore today, in the day when I grew up, there wasn't so much outside pressure on doctors to give recommendations on things and to do certain treatments. You're not always sure that the treatment you're getting is based upon his professional opinion or based upon the pressure to go within the system. Doctors work on protocol, and they really very rarely will vary from that. And so you need to make sure that you're getting the opinions. It's interesting in diagnosis. There is a term. There is a saying called tumor, rubor, color, and dolor, and that means swelling. These are the stages of inflammation. And for all conditions, they all go through. They all have these different qualifications. Is it swollen? Is it red? Is it hot? Is it painful? Right. And it's the combination of these four things which can describe any condition. And so that's why you can get such varying opinions on things. And that's why I think this is one of the most overlooked steps, is getting different opinions. Yeah. Okay?
From my standpoint, do you mind if I ask questions?
Yeah, no, please.
Should I hold to the end?
No.
So, when I'm talking to patients, many of them, if they've been, because we're doing breast thermography, if they've been treating with a certain breast surgeon or with a certain doctor, they're afraid to go get another opinion. Because they're afraid of offending their current doctor or the attending doctor, and they just don't want to kind of, rock the boat. And so they may make a decision without really doing their due diligence. And I agree with what you said. If the doctor gets upset if they're getting a second opinion, then maybe it's time to look elsewhere. If that's
I mean,
a game changer.
It seems as though many times patients, I don't think it's necessarily a laziness, but I think it's really they don't want to rock the boat. I had a woman who had a surgery, a hip surgery, with a poor outcome, and she went back. I said, you got to get a second opinion. So she went to the same doctor for the second opinion, and I said, it doesn't work. You can't even go to his partner. Even though my partner, I wouldn't want you to get a second opinion on my work from my partner because he works with me,
right?
And you tend to be a little more skewed. You've got to get that outside opinion. Patients tend to they're afraid to go out and find out. Maybe 30 years ago, you could get honest opinions. There wasn't the outside pressures. Now you can't necessarily. And right. So I think the responsibility for our treatment is now upon us, and you know, too often we think that maybe we don't know. But as I get into some of the stuff that I'm going to talk about, you're going to find that many times the patient does know. So just make sure it resonates with what you're going to do.
Mm-hmm.
And in this fashion, getting these extra opinions, at least a second opinion, if not a third, before doing any type of treatment.
Right. And it's good to be open, I think, with your doctor about that. You know, if you're having a good communication going on, you should be able to say, you know, hey, I want to get another opinion. And that's expected.
So now, step 4 says, since this was designed in terms of, you know, for cancer or for other diseases, you know, you want to have someone that you can pass things by. And so your family doctor is always a good person. Like if you're treating with a specialist, always go back to your family doctor because he knows you better than anybody else. And pass it by and say, does this make sense? And in this way, you're getting opinion. One of your 3 opinions can be directly from your family doctor, so that he or she can kind of explain where the thinking is behind the diagnosis and the treatment plan. I find this is very helpful when people are dealing with multiple issues, you know, because many times if it's an orthopedic issue, the orthopedist is only looking at it from the orthopedic standpoint, whereas maybe the cardiologist is going to look at it from another different standpoint, or the neurologist will look at it from another different standpoint, and then that puts you at risk because they're only looking at their particular specialty. I'll give you a good for instance. As I had a patient that went to the cardiologist, and he had pretty severe kidney cancer, and the cardiologist was slapping him on the back and was happy because he had a previous heart condition and everything came out clear, even though we know, as we subsequently know, he was going back to his kidney physician, that, oh, this is a real deadly disease that he's dealing with. So the cardiologist wasn't even interested in that. So you can't, right? You know, because his job is just to make sure that you don't die from cardiac disease.
Right. Yeah. So the family doc is kind of like the umbrella. It's their job to put it all together and oversee all of the specialists.
Yes.
Okay.
And to interpret and what's interesting about the type of work that we're doing in our clinic is that we end up having to be that portal. Being a family chiropractor, you know, it's hard to get in to see their family physician, or they call and ask for something, and you're on a telephone line hitting 9 and 3 and 4 and leaving a message, you know. So this is where if you have a health professional who understands the lingo and understands the jargon and can read reports, can at least guide you into the direction as to at least what they're saying, so that you can make an informed decision.
Yeah, that's so important. Yeah, you've got to have somebody that's looking at the whole picture. And that can direct you.
Yeah.
Based on that, yeah.
Now, the next thing is, once you're diagnosed and you're getting these opinions, when you're looking for that, you need to find a doctor that specializes in your particular condition. Anymore today, you know, especially at the big hospitals like at Penn or Jeff down in the Philadelphia area, even for some of the more minute and unusual conditions, there's somebody that's all they really treat. And so it's always nice to find someone who specializes in it. Now, there is a caveat to that. Although there's many different types of cancers and diseases and things like that, and you want to look for someone who specializes, the person who specializes in that may not necessarily be at the larger teaching hospitals. Don't be fooled in thinking that you're necessarily going to get the best care there. You know, but you want to try to find someone who specializes, and what web searches help with that, and so does your medical provider, like your family provider, who can guide you and say, well, I know this guy who knows this guy, and that's kind of the way. That's the old-fashioned way, but that's the way you get the best referrals, because many times, especially in larger facilities, they're not necessarily referring you to the guy down the hallway. because he's the best person for you. They're referring you to the person down the hallway because they're part of that system.
Right, yeah, yeah.
And don't feel, no matter what condition you're dealing with, that you necessarily have to stay within just one hospital or one group. I know personally, I had my surgery with one group down at Penn, and I had my chemo and radiation with another group at Fox Chase for very particular and specific reasons. And I thought maybe I'd have to handle the doctors on it, but not at all. They were fine. They're fine with that. Because they know, and I think when you're an educated patient and you start making decisions like that, they do treat you differently.
Yes, I can see your point there. Yep.
And so, it's almost like with the thermography. When you go in there armed with the data on the thermography, and we're going to talk about that in just a minute.
Okay.
And you're saying, well, this is how these are some of the diagnostic approaches that I'm going to take. And and you have the data, they'll tend to respect and listen to what you have to say much more than if you go in there unprepared. So when you're speaking to your doctor, it's kind of our job now to prepare. It's the patient's job to prepare for that visit with the doctor.
Right, yeah. And to be very clear in their needs and what's going on, I think. Coming from that sort of a point of view as opposed to maybe an emotional upset. You're going to have a script and your notes and your questions and all of that in front of you.
Yeah, because the next step is, well, how do you get your doctor to work with you and to work with you to your satisfaction? And so in step 6, it's how do you get your, I have it titled as how to get your oncologist to work with you, but really it's how do you get your physician to work with you? And the advice here is tried and true. The first thing you want to do when you go in for your appointment, you need to make sure you have a team with you. You don't want to go alone. And the reason I say that is, although, being a physician myself, and when I go to the doctor, I make sure someone's with me so that especially if I'm going to be making any decisions on that appointment, because you'll have selective hearing. And also, if it's upsetting news, or if it's equivocal, you're not sure what you're going to do, you need to have that second set of ears and eyes there. And so I always bring someone with me to take notes, even if it's someone to hold my hand. Sometimes I'll have 2 people. Or I'll recommend 2, one to hold the hand and one to be the secretary or the stenographer. Sometimes the spouse or significant other is not always the best person to be taking the notes because they can get upset depending upon the condition. So doctors work with a team approach. The patient needs to also work with the team approach. And you would be surprised, especially many of the seniors that I take care of, that they sometimes will say, well, I don't have anybody to go with me. And then I'll start questioning them, and I'll say, just ask them. And you would be surprised how people step up and say, yeah, I'll give you a hand. I'll go with you. Yeah. I'll take you, Mary. And that second set of ears is wonderful. Now, how to get them to work with you. This is really important. I think this is the nuts and bolts. You need to be brutally honest from the very start. Don't try to manage your doctor. Don't tell them parts that you think that they want to hear. Just be brutally honest from the very start, and tell them what your needs and wants are. You got to tell them everything. Even though if it may be something that they don't like, you want to make sure that you tell them everything. Okay? And don't try to manage the doctor. Now, this is the...
What do you mean by that, Dr. Leo? Don't try to manage them, like manipulate them?
Let's say my experience is, say I have someone that really believes in supplements, right? And they're very educated. They take a whole supplement program, and then they get diagnosed with a condition, and the doctor wants to put them on something, and they don't tell the doctor that they're taking certain supplements. Well, certain supplements can interfere with medications that you're taking. Certain supplements will interfere with blood thinners, or with chemotherapeutic agents, or with blood pressure, or basically with medication in general, things can interfere. Or say, even if we're looking at it from an orthopedic standpoint, they don't want to tell them that they're running, so or they're exercising in a certain fashion, and so the doctor is doing his work on them and wondering, why the heck isn't my treatment or my injections or my PT or my adjustments, why aren't they working properly?
Mm.
And it's because the patient's trying to kind of manage the doctor or manage the condition. It doesn't mean that you can't do these things, but in order for the doctor to accurately diagnose and come up with a true protocol that works for you, you need to give them all the facts.
Mm-hmm.
And so you don't want to try to manage it because you're not at the stage that you can.
Right, okay.
Does that make sense?
Yes, that does make sense. Yes, I understand now what you mean.
Good. So tell him or her exactly what your needs and wants are. Now, once you've had your say, okay,
Mm-hmm.
here's the key. Here's the absolute key. You need to shut up and listen to what they have to say. Okay? Right. Totally. You just be totally silent, and that's the good part, where I had someone with me that would break out the duct tape and put it over my lips, so that I would try to be convincing that I was right.
Mm-hmm.
Because here in the long run, as a patient, you are right. Whatever your viewpoint on it is right.
Mm-hmm.
You just need to. It's most important to keep that open line of communication. Ultimately, the patient's job is to evaluate the data that you get back from the doctors, and then make the decision for yourself. But if you're too busy trying to convince your doctor that you're right, and that, yeah, you should be taking this or that, or you shouldn't be taking this or that, or this therapy should only work for so long with that therapy, you're going to lose that line of communication, and you're not going to get VIP care from your doctor.
Okay.
And a good practical experience, I hate to always bring it back to what I've experienced, but I was told when I was getting evaluated whether to do radiation and chemo. When I went in, I went in and said, this is what I want, and I told them everything that I wanted, and the one doctor got very angry at me, and I sat there, tried to convince him that I was right. And I found out later on I was right, but now the communication broke down with him, so I went to see another doctor, and followed my own advice. I got my 3 opinions, and went to see another doctor, and lo and behold, he sat there and listened, and then I shut up, and he said, well, I'm not comfortable with that. And then the magic words came out of his mouth. He said, but you're the patient. You can do what you want to do. So,
okay.
And it was interesting. He said, I'm going to tell you what you need. And his recommendation was exactly the same as the other physician, but here this was a guy that he let me have my say, and then I had my say, and then I listened to what he had to say without trying to convince him, and he never, actually at the tail end of it, he actually agreed with me, and then my care was managed properly by someone who was interested in me, and I got VIP care out of it. But that's the most important thing, is you need to just be quiet and let them have their say.
Mm-hmm.
And now, on top of this, so that's probably the most important thing, is to get your say out and then be quiet, or as I put in my notes here, to shut up. But ultimately, the call for what you need to do is not your wife or your spouse or your brother or your family doctor or your friend. The ultimate call on what you want to do in order to get the VIP care is your call. And when it's fully your call, you'll find that you'll be able to be comfortable with the decisions that you make. And here's the hardest part, is to not be afraid.
Yeah.
You make your decision and don't be afraid. But the important thing is you need to be open to changing your mind, so that you're constantly, this way you have the communication from the doctor, because you say what you want to say, then you be quiet and you listen to what they have to say, and then here's your chance to have an open mind, and you say, wow, I hadn't considered that. And it becomes a real communication between you and your doctor. Most doctors will be very, very honest with you. And if you don't come out as being combative, you can be very honest with them.
Mm-hmm.
And then at this point, nobody's intimidated, and you have someone that will work with you. Doctors will, trust me, they all will work with you, you know. You just need to find out. You need to first, again, get matched up with the type of doctor that you want, and then just follow the steps so that they'll communicate. So, because the most important thing as you go through any type of treatment program is to have the communication between you and your doctor. Otherwise, even down along the line as they're doing checkups or they're checking for your side effects and so on and so forth, you're not necessarily going to get you'll get managed by the book instead of by you.
Yeah.
You know, I think what's interesting is once you get the data and you find out, it's always good to make the decisions away from the examination room. This isn't like buying the car that the deal's only going to last for the next 20 minutes and he's going to pull it off the table.
Mm-hmm.
I always recommend you get yourself out of the examination room and then even if it takes another day or two or you make another appointment, for the big decisions, take your time and make that decision. You want to make sure.
Yeah, that's really important because I think, from what I hear, what people are telling me, they go into this, vortex and kind of all chewed up and spit out the other side where they feel like they don't have any time. They're getting. It feels like they're getting a lot of pressure, or maybe they are getting a lot of pressure to make very quick, life-changing decisions. So to hear you say, take some time, step out of that, step out of the room or out of the exam room, sleep on it, talk about it with somebody else, and then try to make a decision.
Yeah, it's fine. We spend more time. I have a buddy that just bought a truck, and boy, he did Consumer Reports and the Blue Book and shopped. He probably shopped for a month getting the best deal, and it was delivered up from Delaware to get the best deal to save $100 on the truck, but maybe they don't necessarily do the same thing. They just go, okay, that's what I'll do because I'm scared or they're frustrated.
Mm-hmm.
So take the time. We spend more time planning our vacation than we do choosing our healthcare options.
I think you're right there.
Now, the next step, now that we get through that, we're communicating with the doctor. I want to remind you that doctors follow protocol. Oh, I had slides on these. There we go.
Oh, what was that shut up one? Go back.
Yeah, let me.
Now shut up and listen.
Yeah.
That's so important. Don't be combative and don't try to convince them. They understand what you're saying. They just don't agree with you. So stop trying to convince them that you're right.
That's right. Because you are right. You're always right.
Yeah.
And we know just the placebo effect. Knowing that you have an opportunity, I think people heal better just from that lack of stress within the system.
Yes. Yeah.
So definitely, and I think be open to changing your mind.
Mm-hmm.
It's really important.
Right.
Now,
yeah.
Here's the trick. Once you now have good communication between you and your doctor, you found a doctor that you can communicate with, and you're able to share ideas back and forth. Now you need to read between the lines. Okay, you got to listen what they're saying and read between the lines. Remember, doctors follow protocol. And many times they follow protocol, and this is a direct quote, because that's the way we've always done it. And I'll say, well, where is the data on that, when I'd be asking for it? And they'll say, well, that's what we do.
Mm-hmm.
And, and sometimes it's true because that's what does work. But in terms of especially, diseases like, say, a Lyme's diagnosis, well, that's what they do. It keeps changing every month. When you read the periodicals in the journals, they're not really sure what to do. They just have a set protocol, and then they follow that. And depending upon when the last time they read a journal or the last time they did some continuing ed on it, it can change. And so they follow protocol. And the reason, and I understand why, being a physician myself, there are certain ways to do things. Protocol many times misses the, or at least it keeps them from there's a good thought out way to follow things, okay? But it does change as you go along. And so protocol many times is based upon old science. I had a conversation with a surgeon down at Penn, and we were discussing some different types of therapy, and he said there was this one therapy they do in Germany and they do in Mexico, and he said, oh yeah, well that's cutting edge. And I said, well, exactly, why aren't they doing it at Penn? He said, well, we don't just take anybody's research. And I said, but they've been doing it for 15 years in Germany. And I said, it's very successful. Oh, yes, it is. He said, but we study everything at Penn. We do it the Penn way. And, sometimes that's good, but then sometimes that holds up things. And so you're waiting for them to catch up. I mean, we would see it in orthopedics and chiropractic. I've been in practice long enough to remember they had a test called a myelogram where they would shoot dye into your spine, and this is pre-MRI, and they would see the dye would be displaced by herniated discs, and they say, yeah, there's a herniation there from the myelogram. There were doctors still doing myelograms into the late 90s, and they stopped. The protocol for that stopped in the mid-80s.
Wow.
But it's because that's what they learned and that's what they were doing. So anyway, so that's the idea of protocol. So, but here they won't vary that necessarily when they're given recommendations, but you can read between the lines. That's why you take notes. That's why you step away after when you're making your decision. Read between the lines as to what they're really saying. And so, so this way, every visit you voice your opinion and then listen, so that. And then you'll find them softening. Once they know that you're looking for a certain way to do things, they'll end up saying, well, this is what I would recommend, but these are other options that could be on the table for you. So, you must talk to them in a calm, confident way so that when you voice your opinion, they're going to listen. And then in this way, because that's one of the things that we talked about managing, don't try to manage your doctor. Just get the data, and then you're able to just give your opinion. But listen to what they're saying and then read between the lines. And they'll give you the answer as to what they think you should do, honestly.
Okay. So, I think I hear what you're saying. So they're following protocol that may be set up in the hospital or in their office, and, they have to follow that maybe due to time constraints, or that's the way it's done, and they don't want to vary that because of maybe legal issues or what have you. But they may be giving you little hints and clues in there.
Yes.
Okay, yes. So that's what you want to be looking for.
As a matter of fact, I'll give you an example. I had a patient who went in and had a surgery, and this was for a cancer diagnosis, and they weren't sure. It was recommended to go through the full megillah of chemo and radiation. And they had decided, well, they're going to wait, and they didn't really want to do that. And the doctor said, well, I recommend it. I strongly recommend it. And then later on, and they didn't, and everything turned out fine. Later on, in the follow-up, they're like, oh, yeah, well, and this is how you read between lines. He said, I understand fully why you want to do that. And that's... You see, that's kind of saying, if you're calm and you're listening, you're like, wow. Because really, if most doctors, if a patient's not going to follow what he really believes and thinks, he's going to really stress it strongly.
Right.
If it's just a statement, well, then it's on the record. He said what he needed to say, and then he'll step back from it and let you make your call. Do you follow? So. Yeah. Just know that's kind of the way the system is set up today. Doctors don't necessarily give their opinions, they give protocol.
Okay.
All right.
And they don't necessarily write that protocol.
Oh, no.
Right.
Nor, for goodness sakes, nor do they believe in that.
Right,
protocol.
Exactly.
I remember back in the day finding a pediatrician for my kids, and I said to the doctor, well, would you do that for your child? And he said to me, well, that's none of your business. And that was the answer right there. The answer was, well, no.
Yeah. Right.
No. Otherwise, he'd go, well, you're darn right, I would, and I believe exactly in that. You should do that.
Right,
And
exactly,
so
yeah.
I just found a different pediatrician, and the pediatrician that I finally found said, all right, well, why? And then he listened. He said, okay, I can appreciate it. I recommend such and such, but
Mm-hmm.
I understand why you want to do that. In other words, he's saying, I will take care of you, even though I either, read between the lines.
Right, yeah, yeah. And then, as you said earlier, just to be able to know that you're being heard. He may not agree, but you know that he was listening and he heard what you said. And he's taking it into consideration.
Right.
And responding in a way that shows you that he was actually listening. And that's empowering. That's having a conversation.
Amen.
That's not being talked at or talked to, it's being talked with.
That's right. That's right. And that enables you, just from the whole placebo effect that they've been able to study, you're more comfortable. You believe in your doctor, you have confidence, and your chance of a better outcome is much higher.
Right,
just from that alone.
And from the people I talk to, that can make or break it. Just that simple little thing right there.
That's exactly right.
Yeah.
Now the next one is be your own advocate. It's you need to take responsibility for your own health. Don't expect the doctors to do that. It's first off, just in the healthcare system today, it's not set up for that. It's set up to be your own advocate, and don't invalidate what you know, what you feel. A proper healthcare decision resonates, and it just really makes sense to you. You go, you know what, this just makes sense, even if it goes against what your spouse wants or what your doctor wants. It truly a proper decision, because I believe that your body tells you.
Right.
And I don't mean to make that sound metaphysical, but it's true. The body will tell you exactly what you need to do, and just listen. Just like you need to stop and listen to the doctor, you need to stop and listen to yourself and what your body's telling you.
Yeah. Well, it's important. Our higher self, or our bodies are self-healing mechanisms, and if you get quiet enough to listen, you stop and listen, it will tell you. But I think if you can share anything about that, how did you, if you want to share from a personal experience, how did you get to the point where you were trusting what your body was telling you, without second guessing and going back and forth? Were you able to do that?
Yeah, that's the important part, to do that. And I think too often we feel that we're not as a patient, we're not educated enough, or the doctor always knows best, and they may, but the doctor doesn't know your body. You know your body. In fact, the next one is know your own body. Pay attention, go into that quiet time and listen to the symptoms from your body. You may be responding quicker. You may be responding slower. You may not be responding at all. And that's why you want to make sure that you keep good notes. Because getting into the next step, our duties as patients are keep good notes. Make sure you keep a calendar and then report back. Doctors love that. Physicians love to get the information, because then, how often, do I have someone come in, that sees me and I can see that they have pain and they're dragging their leg and they're really in a lot of pain and discomfort, and I go, hey, Bill, how you doing? And he's like, I'm good, Doc, thanks. And they give me that social back, and I want to go, well, no, you aren't. That's why I don't ask how you're doing anymore. I always ask anything I need to know, and then that gets away that social veneer. And
their need to please you, right?
Yeah. It's interesting how patients will tell my staff good information, more than sometimes they'll tell me, because they don't want to say they're not doing well, or they have bad news to report. They don't want to upset the doctor. It's the craziest thing I've ever heard. But it's very common.
Yeah.
Now, no matter what, the next part of our duties is always treat all the staff that you run into with kindness and respect. You'd be surprised how suddenly you need a favor, you need a report, you need something, and you're nice to Mary Sue at the front desk or to the person that checks you in. If you just are nice to everybody as you go through with respect and kindness, you'll get VIP service because they're like, oh, we want to see him. He was a nice guy or she was a nice lady. So that when you go back for follow-up, they're very apt to make sure that you get good appointments and that, because staff run the doctors.
Right, yes.
Okay, and so be good to them.
Yeah.
And treat them with kindness and respect.
Right. Don't be mistaken in thinking that if you are disrespectful to the receptionist or to the office manager, that that's going to go through the office like wildfire, and that patient will be labeled difficult patient.
Yeah, that's right.
It doesn't just end there, and that's so yeah, it's so important.
Yeah, because as you look at it, you always want to treat them with the kindness and respect. You want to become the favorite patient so that they're ready for you when you come in.
Right.
And be on time. Now, I know physicians are notorious for being late. But if you're on time, then you have ground to stand on when you say, well, I've been here. I keep my appointments. And you'd be surprised it'll come back to you. Because nothing irritates these specialists more that you're trying to manage them by, well, he always runs an hour late, and then the time that he's actually on time, boom. So
yeah, right.
Part of that also, this is just common courtesy, just for anything. Refrain from complaining, but don't feel like you're being a pushover. If you have an honest complaint, you state it, but you state it in a professional manner.
Right.
Don't be a pushover. Okay, because it's the idea once they know that you're dealing with someone who's kind and respectful, but then has a valid concern, it'll be addressed. These are the patients that I know my staff love, and it's funny, they'll come in and say if they need to see me right away, they'll get the immediate appointment, or I'll have my case manager come up to me and say, Mary's coming in today, you better fix her up and make her better. It's I have a higher authority to answer to, and that's my staff. So
right, yeah.
Remember that professionalism and respect do go both ways.
Right.
Keeping these little tidbits, they'll help you give VIP service.
Yeah.
Okay.
Yeah. Well, you know what? I think that these 10 rules, I'm going to say, are not just ways to get VIP treatment from your doctor, but they're ways you can live by these rules, right? I mean, you can put this in any part of your life when dealing with any of the people in your life. Not necessarily keep notes and report back, but treat with respect and kindness and be on time. Don't complain, don't be a pushover. All of these things would serve you well in many relationships.
Yeah, I think there's some truth to that, isn't it?
Yeah. Yeah.
So are there any questions that...
No, I don't see any questions yet, but people feel free to if you have any questions. Kate did say, awesome, I love these last points, and there were some people that were having a little bit of trouble hearing, but everybody was able to hear it, and Kate says yes, she loved these points, and I think they are, really, I love how you kind of broke it all down, because there's things that we think about, but seeing it written and talked through, it really just makes a lot of sense.
Nice.
And not that difficult. Kate asked, working with naturopathic versus AMA approaches, I guess.
Yeah, and Kate, I would suggest as you look at that can be one of your opinions, one of your second opinions, and then as you come across and you get the data, say from a naturopathic doctor, you present that to, say if it's something like a cancer or a Lyme's diagnosis. I like to use those because it's such in flux. It doesn't mean that, because you'll get different approaches. You have to take a look and say, well, what resonates to me? What do I want to do? You mentioned here, how can you get openness with the docs? Well, the way to do that is to go in there being open yourself. Make sure that you present what you're going to do, and and then listen to what they have to say. I mean, sometimes they just don't even know. I know when I was meeting with one of my chemotherapeutic docs, I was taking saw palmetto, which helps prostate. You know, as I'm getting older, you know, your prostate can sometimes act up. And I had said to them, they had said to me, we really want you to go off of all your supplements. And I said, well, these are the ones that I'm taking. Which ones can I take? And I said, I'm taking saw palmetto. And the doctor actually, and saw palmetto's been around for years.
Mm-hmm.
And he said, I don't know what that is. And I said, well, it's for prostate. And he went, oh, really? Yet he had no clue.
Right.
And which is bread and butter for anybody that knows supplementation, right? So
Right.
I had my phone and I pulled it up. I Googled it for him to show him, and he looked at it a couple things, and then he turned around and said to me, "Yeah, this will be fine. You can take this." You know, so
Yeah.
you know that you follow these rules. It's not a perfect system. It's not like it's going to be kumbaya, but it always comes down to at least you're letting them know what you're doing, even if it differs from what they want, and then you can make your informed decision.
Right. Yeah. Yeah. And I love what you said about go in open yourself, because there are a lot of people going in with negative attitudes, or like it's East versus West, or it's natural holistic health versus conventional medicine, and it doesn't need to be that way. We need to be working together.
Yeah, I think I hate that it grinds me a little bit when I think of the idea of conventional and non-conventional and alternative and conventional. I think maybe a couple generations from now it'll just be healthcare.
Yes, that would be nice. Healthcare would be nice, yeah.
Healthcare, or wellness care, So, sometimes it'll come up. I know that Kate has a question about there could be legal repercussions as a parent, but maybe not as much when choosing an alternative approach. There could be. That's something that you would want to discuss with your doctor, or if you have an attorney, a family attorney. But I find, generally speaking, you need to be open to all different approaches, but the choice comes down to yours. And I think, again, not to give you legal advice, but I know that the law comes and protects parents quite a bit. That you do have self-determinism over your patients, and very much so yourself. Just because a doctor says you have to does not mean you have to. It's always up to you.
Okay.
One question is, what if you get different opinions from two of the same type of specialist? How do you know who's right? Michelle, I think that's probably your question. Sometimes you just want to put faith in one doctor or the other. I think what you want to do is, if you take a look and you take notes and you listen to what they're saying and read between the lines, I think the right answer will come to you. Just go back and you may need an extra appointment with each one to really get their opinions and see you'll get answers in between the lines there, and then you'll be able to make the right decision. And one may be better on one approach than the other. So that's what I would recommend that you would do.
Okay, that sounds like a good answer. Well, there we go. Kate said, also, how can I see the archives, and can I share this one with my brother? Kate, the archive will be on the website. It'll be up in a day or two. So since you have logged into this, when the archive is available, you will be sent another email, and then you would be able to share that with your brother. He could just go on the website, tdinj.com, and go to the webinar page, and he'll be able to view it.
Good. Well, yeah. I think in conclusion, one of the things that I really want to stress is you have rights to your own body, and you have also a responsibility to your body. And so following basic rules is not only helpful, but it gives you back your sense of control. And it makes you calm. And when you're going into decisions for your health care with calmness and with data and information, you'll always make the right choice.
Mm.
And it may not seem right from the outside, but for you, it'll be the right choice for you.
Yeah,
And
right, yeah. Very important. Yes, thank you for sharing that.
you're welcome.
Yes, thank you, and thank you for being so patient with us when we're having these technical difficulties, and for donating your time, not just to this hour that we spend together, but putting together your PowerPoint and the run-through and all the time that it takes. So I just want everybody to realize that that Dr. McCormick and all of our speakers do this on their free time as a way of communicating and educating our listeners, and we're very grateful for that, and we thank you.
You're very welcome. It's my pleasure.
As always, it's a pleasure, Dr. McCormick.
Thank you so much.
Thank you. So, listen, guys, if you like what you're hearing, as you know, your confidence is our highest compliment, and if you find value in our webinars and in our services, please leave us a review on Google or Facebook, and you can find us by Googling Thermographic Diagnostic Imaging on Facebook. Dr. McCormick, do you have a website you'd like to leave, or any information that people can contact McCormick Chiropractic?
But yeah, it's McCormickChiro.com.
Okay.
I was almost going to say www, but my son told me that you don't have to say that anymore.
I know, it's hard to not say it, right?
Yeah.
How about a phone number?
And our main office number is 610-705-0201. And that's 610-705-0201. You can call and leave a message for me, and I will get back to everyone personally.
Okay, thank you very much. And just some notes on our next speaker, which will be on Wednesday, May 25th. Dr. Galgano is also a chiropractor, and he's going to be talking to us about how advanced spinal care can help you heal naturally at any age. So that'll be 7 o'clock, Wednesday, May 25th. So thank you all for joining us. Dr. McCormick, thanks again, and we wish everybody a good night. Thank you.
You're welcome.